Hi everybody, now we go to the QC part 3. Remember, in the last video, I have mentioned about the external quality assurance, EQA. So on this part, we will go deeper on the external quality assurance. So for introduction, the definition of EQA, it is a system for objectively checking the laboratory's performance using an external agency or facility. Therefore, EQA can specifically used for checking the quality of tests or to check the overall quality of a laboratory. And the other name for EQA is external quality assessment and proficiency testing. There are few types of EQA. The first one, and many laboratories use it, is proficiency testing. Sorry, it is quite difficult for me to pronounce it. Second, rechecking or retesting, inter-laboratory comparison, and the last one is on-site evaluation or audit. Okay, let's talk about the proficiency testing first. So, what happened in proficiency testing? The external provider, there is a EQA organizer or provider, that will prepare the sample for testing and send to the participant laboratories. The laboratories participant in the program analyze the sample and then return their result to the central organization. Results are evaluated and analyzed. The EQA organizer then submit the proficiency testing performance report to the participant laboratories. The report are provided with information about their performance and how they are compared to other participants. The participating laboratories use the information of their performance in EQA to make appropriate change and improvement, which is to make corrective action. So in terms of for test quality, the term EQA and proficiency testing are used interchangeably. Another type of EQA is rechecking or retesting. Samples, usually slides, that have been analyzed with available result are collected from the participating laboratory and sent to the reference laboratory for rechecking. So this will allow inter-laboratory comparison between participant lab and reference lab. Okay, now for inter-laboratory comparison, a laboratory set an exchange of samples among a set of laboratories, minimum 2 laboratories, usually applied on specialized tests with no proficiency testing scheme or very few of laboratories that perform the test. Example of the test is in mycology area. So for this example, the small laboratory made a mutual understanding with big laboratory. So they will determine certain sample, analyze it, and make a report from it. Afterward, they will send to the big laboratory to do the same. The result that obtained will be compared. If there are any discrepancies, they will troubleshoot which one is error and make correction. On the other hand, the big laboratory also will do the same. Usually, they will do few times in a year or in certain interval times. Another kind of EQA is on-site evaluation. It is for a test that done in one lab only in the region. No proficiency testing scheme provided. It is also referred to as audits, assessments, or supervisory visits. Usually, the lab will go for certification or accreditation. The audit will be conducted by external group or organizer to verify that the test is done in proper way. So in this process, there will be a pre-evaluation preparation in which the lab participant will do some preparation like collecting information or records, and then the auditor will come and do the entrance interview, and then the auditor will go into the laboratory, do the observation of facilities, process and procedure. From here, they will gather the information, and then the auditor will make the outcome of assessment. Afterwards, there will be conference where the auditor will meet the lab participant and present what is their finding, what is good and what is bad. After that, the auditor will make some reporting and give the report to the lab participant. Then from that report, the lab participant will do some corrective action on what error that have been happened in the lab during assessment. So, what is the benefit of doing the EQA? Yeah, why lab go for EQA? So, EQA will allow comparison of performance of testing among different laboratories. EQA also provide objective evidence of testing quality, in which EQA helps to assure laboratory and customers such as physicians, patients and health authorities that the laboratory can produce reliable results. Individual laboratories can use EQA to identify problem in laboratory practices, allowing for appropriate corrective action. Yeah. So when performing the EQA, it will include the whole process that include in the test. Any error in the test step or operation will be exposed in the EQA report. Therefore, it can be used to detect any area of the test step that affect the reliability of the test and result. So it also indicates area that need improvement. It also identifies training that needed. So sample received for EQA testing as well as the information shared by the EQA provider are useful for conducting continuing education activities or CME. Any areas or tests that had been troubleshoot and execute the improvement can be discussed among staff and becoming sharing knowledge session. It also required in licensing such as accreditation ISO 15189. Some region or countries require that diagnostic laboratories must have an accreditation certificate to enable it to operate. Most of the accreditation scheme specify that EQA participation is essential. I will discuss furthermore on proficiency testing. Please take note that from this slide, proficiency testing is EQA and EQA is proficiency testing. I think it is much easier for me to not to call it as EQA, and it is the most common EQA that being executed by laboratories. So the EQA have many area of coverage. Most of laboratories diagnostic, example chemistry, hematology, microbiology and etc. And the management responsibilities, they should determine the policies for EQA. They should determine the person who are responsible to manage the EQA activity. Usually scientific science officer are responsible for carrying out the task. The management also need to determine or approve what EQA scheme that they want to participate. There are many schemes that are offered such as RCPA, ECAS, NICAS, RICAS and many more. The scheme that laboratory want to participate must be worth with the allocated cost. The management also need to monitor that the EQA sample are analysed and reported to the scheme as scheduled. Lastly, management must make sure that there is standard operating procedure on the EQA activity. This is to ensure that the PIC will do the job accordingly and standardized. Okay, I want to pinpoint the person in charge, since this person need to manage the EQA program a lot. So the PIC need to make sure that the laboratory participate in the EQA program. That is, that person must register in the EQA program, make sure that the sample are analysed according to the schedule, distribute the EQA sample among staff or section based on rotation schedule if necessary, do the troubleshoot and take corrective action on non-performing EQA result, and communicate the outcome to management, which is this PIC need to present the EQA performance at specified interval, whether in by weekly, monthly or yearly. And this person also need to monitor and maintain the related records, such as EQA records, corrective action record, the SOP of how to perform the EQA, copy of EQA participant certification, and any other as necessary. The good EQA scheme should have these criteria. First, internationally accreditation. The EQA scheme is accredited by national or international accreditation bodies worldwide. Has many participating laboratories. This will create a large database user and increase confidence in statistic value, minimum 20 participants. A high level of participation means peer group numbers are maximized and ensuring availability of data for a wide range of instruments and methods. Numerous and varied samples. The EQA scheme able to provide numerous of tests and samples. This will reduce the burden of purchasing the EQA material from various EQA schemes. Several distribution throughout the year. The more frequency of EQA testing will provide higher frequency in monitoring the quality of test. Rapid report turnaround. The faster the EQA scheme could give the report, the faster the laboratory could review its performance and do troubleshooting on non-performing tests. This will maintain the accuracy of the test. Preferably electronic result entry and report return. Electronic result, no cost on paper and postage of fax the result, so much cheaper. Friendly and helpful advice in troubleshooting. The EQA scheme should willingly to give help to understand the report and advice in troubleshooting. The report also should be user-friendly, that is easy to access the report and easy to understand. High quality samples, of course, samples spanning clinically relevant levels and helping to ensure accurate instrument performance. EQA also should mimic the patient's specimen. And additional, the reference method values are provided for selected parameters whenever possible. So this is how the EQA or proficiency testing material are handled. So first, the EQA provider will send the EQA sample to the laboratory participant. So the EQA sample received, and then the lab will analyze the EQA sample on interval time or on scheduled time. The result will send to the EQA organizer, and then the EQA organizer will analyze it and receive and give the report to the lab participant. So afterwards, the lab participant will review the EQA report, and if there is any problem, they will do the troubleshooting, and the corrective action will be taken if required. This is the example of EQA report. In this report, your result will be compared to whole participant, sample 1, sample 2 to the whole participant, same method participant, same test principal participant, same analyzer participant, and lastly, same supplier or reagent participant. This gives information on whether your result is acceptable or not if compared with all results and your method classification. The test performance will be accepted based on specified limit, either allowable standard deviation 2SD or allowable limit performance, which is the EQA scheme will decide after compared to the whole participant. If your result is outside from the specified limit, you need to compare with the same method participant and or with other criteria. If the result is still violated, then you need to do troubleshoot. After all the troubleshooting need to be recorded and present to the management and staff later on. This is another example of the EQA report. This shows that the user need to troubleshoot or investigate the uric acid test. For example, because it is the participant's laboratory is outside from the group method. Maybe the PIC need to inform the supplier and discuss why the uric acid test performance is outside from its own method, which has the same test method, same reagent, and same analyzer. So, what errors could happen and affect the EQA performance? Well, these are the factors that could cause that. Okay, let's look on the pre-testing. The possible error, maybe the sample compromised during preparation, transport, or after received by improper storage or handling, mislabeling, and wrong data entry. Under the testing phase, the possible error could be the reagent problem, test method, calibrator problem, temperature, and operator. And for post-testing phase, it is the possible error, maybe wrongly key in the result, wrong reporting, especially for text result, or reporting format interpretation, report format interpretation. So this is the example of troubleshooting and corrective action form. So when you did the troubleshooting, you need to record the investigation, do the corrective action, and record it. Remember, this data need to be presented to other laboratory member, so they will avoid from repeating the error. So with that, I end my presentation on QC Part 3. Thank you and good luck to all of you.